This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PH.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and happy St. Patrick's Day. I will have you know I am wearing green, and I even have green socks.
Whoa, John, you're duded up.
Now, Dr. Molly didn't get the memo.
No.
So what she's wearing, well, your temple sweatshirt.
Sure.
But everyone's Irish today at Temple.
That's right. That's right.
Okay, we're fine. Welcome to another edition of Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly FANTASIA, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. As we always say here at the top of the show, we discuss the who, what, when, where, why, and how of Innovative Medical Associates, how they can potentially help you and any member of your family improve your overall quality of life. And again, we do that with Dr. Molly. And if you have a question for Dr. Molly at any time during the course of the show, or you have a medical challenge, call us right now at 855-839-1210, 855-839-1210. Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. And as always, Dr. Molly, what are you doing?
Okay.
What do you
Hey, John,
do?
Do you know what's interesting? We never get tired of explaining to people what we do because invariably I always get the questions. You are so right to do this.
Yes.
Okay.
Well, people ask me, they say, well, what does Dr. Molly do? And I said, well, I get vitamin C infusions.
Yeah, that's right.
And then, well, what does that do? And it's like a million questions.
That's right. So fundamentally, we have a like-minded group of healthcare providers who work out of our primary care facility. So again, I'm going to tell people we can do anything that a normal primary care facility or doc can do. If you need a prescription, the docs can write for the prescription. You need radiology, we send you out. As a matter of fact, I feel like I'm having a love affair with a certain radiology group right now, and it just is one of the tools in our bag. So again, we can do anything that any ordinary primary care physician can do. But what we do, it's our philosophy that makes the difference. We believe if we can help a patient effectuate a change in their medical status, whatever kind of challenge they have, can we do it by augmenting the pharmaceuticals by utilizing natural substances, John?
And the natural substances replace, maybe?
Maybe, but most times they augment, and we're able to cut down on some of the pharmaceuticals. And the idea is that possibly that's a temporary thing. In other words, as we work with the patient with the medical hydration, we may be able to change outcomes so they can get rid of their medication. A good example for that is utilizing certain substances to help people with high cholesterol and those kinds of things without going into the new category of those drugs. So again, in helping people with their lifestyle changes. So these are the things that we do.
You know, we talk about this all the time. Now there's a whole new bunch of drugs.
Oh, yeah. Everywhere, in every category. And there's a whole new bunch of illnesses that most of us never heard about before, right?
And they go over the side effects, like 15 seconds of the commercial.
Right.
Do you find that that's a common theme in all prescriptions?
I would say that's a common theme in all prescriptions. And in addition, I think that's been the motivation for people to look for other alternatives, meaning more natural things to do, because the more sophisticated these drugs become, the more likely they're going to have sophisticated side effects. And people are very aware. Listen, the people who listen to you and listen to our show are pretty thinking people. They get it. They get it. They know if they need a medication, it's important to stay on that medication. The one thing I would say that I'm seeing more and more of is that people come in and want to get off the medication, but they want to do it quick. And that, in turn, causes other problems. And maybe they've gotten off of it before they come and see me, like in 2 days. It's like it blows me away. And so we want to guide our patients. That's the other difference. We want to guide our patients in how they should approach this thing and do it correctly so they don't have rebound.
Don't stop your medication. No,
you'll never hear me say that, right? Never.
And I did that once.
I remember. Listen, there are certain medications that you absolutely, when you do that, you're going to end up with a rebound and actually have a worse situation on your hands than the one that drove you to take the med.
Do you find there any side effects with the natural products?
Sure. That's one of the things we got to talk about. I mean, in 27 years, I've never seen any serious side effect to any of the medical hydration that we deliver. Number one, I think it has to do with the purity of the products and the quality of the product. Secondly, it depends on what the patient comes to us with. If they're highly allergic, I obviously want to know about that, and we want to help the patient make sure that we can avoid anything that may give them an allergic reaction. But I can tell you, John, the only thing I think I've ever seen is that people don't eat before they get their medical hydration, and there could be a change in their blood sugar, and that then makes them feel a little funky. But other than that, and then people who are afraid of needles. I mean, that's the side effect, right? You've seen that too.
Yes, I've experienced that.
That's right. That's right. So,
but that's why you have crackers and things.
That's why I have not only crackers and things, I have great nurses. So it's not going to be a problem in our facility. Yes. But honestly, in 27 years, we can just count how many side effects we've had. Very, very little, if any.
When you start the treatment,
yes,
you go 4 or 5 treatments.
Sure. Right.
What is the diagnosis like? You're going to get 20 treatments,
well,
30,
here's
40?
The deal. It depends, obviously. If you're coming in for what I consider well care, you just maybe have a small problem, that you've been taking your thyroid medication, you're doing everything that your primary has told you to do, but you need a little tune-up. You have a little more fatigue than usual. We may run some blood work and check that out, but fundamentally, someone like that might only need 5 treatments. I really don't believe in doing one treatment and done. I don't believe in that because obviously you cannot get the full effect of the constituents in these nutraceuticals to make you feel better, to improve your quality of life. So we generally tell people we don't even want to see if you're not going to do at least 5 treatments, but that's 5 weeks, over 5 weeks, and boy, do we see a difference. And just about everyone we've done this to in terms of certain conditions have seen the improvement, both in the lab work, qualitative, and qualitative in how they feel.
People ask me, how long have you been coming
here?
Oh,
yeah, I know.
And I say, 20 years. Wow, are you really sick? And
no, you're really well.
Yes.
You're really well. But you have comorbidities. This is the other thing, John. Most people come to me, they don't have one problem. They have multiple problems. Yes. And it's the multitude of the problems that really has contributed to their lack of quality of life. So the idea is we have to sit down and say, okay, which one of these demons are we going to effectuate the change on first? And which one is really causing the most problems? Also, people come to us for supportive care through chronic conditions, autoimmune conditions, and cancer conditions, which we'll talk about a little later, that we know are definitely going to impede someone's quality of life. So it does take a little time. Usually people start to feel better in as little as 5 treatments if it's not a serious condition that has multiple challenges. If you have multiple challenges, look, you're going to probably need 10 to 20 treatments. And then you're going to need a maintenance in order to maintain the reserve once we get that into you.
We are coming up on our first break of the morning. The show is called Health Watch, and we are here every Sunday from 8 until 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. I'm your host, John DeMasi. We have a lot more to talk about here on the show, some fascinating cases that Dr. Molly has experienced this week in her facility, and your questions. If you have a question, 855-839-1210 is the number. And we always tell you to call early because every week we get a call at 2 minutes before 9. So we can't do much there. 855-839-1210 is the number. Dr. Molly and I return with more of today's Health Watch after these words. Back here on Health Watch, and as always, when we're here on the radio, operators are standing by at Innovative Medical Associates. 856-489-0505. That's 856-489-0505. And we talk a lot about a lot of things here on the program. And if you're wondering, can Dr. Molly help me or whatever your condition happens to be, or you're a member of your family? Well, all you do is, and it's very simple, call the operators and book your appointment for the initial consultation. It is complimentary, doesn't cost you anything, and you'll really get some peace of mind as to whether Dr. Molly can help you or not. 856-489-0505 is the number. That's 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our program is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210, WPHT. 855-839-1210 is the number here in the studio. If you have a question or a medical challenge you want to run by Dr. Molly. Before we get into what we're going to talk about here, which is diabetes, I just want to ask you. I've heard you mention this before, and I heard you telling a patient the other day, ashwagandha.
Oh, yeah, ashwagandha. I love it.
I remember you saying that's one of your favorites.
Yes, it still is.
What is it?
Well, ashwagandha is an Indian herb, and it's been around for centuries. My original medical director loved ashwagandha for the calming effect. I love it. It's good for overall well-being. I love ashwagandha. I love herbals if they're used properly. And, listen, folks, you got to be careful when you go in the health food store and pick up herbals because you want to make sure you're getting the pure herbal. I only use one or two brands, I have to say, and I won't mention them on the air. And fundamentally, I can tell you that ashwagandha is still at the top of my list. It really is. And actually, since we're talking about diabetes, there are some herbals that are very effective in helping diabetics cope with lots of reasons of the insulin resistance.
And if you want some advice, and this is what I recommend.
Yeah, you're tough, Joe.
Don't go into the health food store blind,
right.
Because that's what a lot of people do.
Right.
Oh, yeah, give me this. And the next thing you know, you have 20 bottles, and a lot of them do the same thing. So Nurse Barbara at Dr. Molly's facility is an expert and she'll even tell you what aisle to go in. So,
well, you know what, John? That's absolutely true. Did you ever look at my desk? And
yes.
see how many volumes of herbal remedies I have, how many volumes I have of nutritional medicine things? You know what, guys? This is as much an art as it is a science, but the science is what excites me. And these herbals work on particular pathways, etc., and they work on a cellular level in a certain way. But you got to give credit for all the ancients who were ahead of us and knew how to use them. So the question is, I like them. Yes, I think it's great, and it's great to go to somebody who's really an herbalist. I won't consider myself an herbalist, believe me. But as a scientist, I can see many of these herbs and understand the constituents and how they work.
Okay, 855-839-1210. That's our number here in the studio, and we are going to talk about diabetes.
Diabetes.
It's a problem, yeah.
Oh, man, is it ever. You know why I'm talking about diabetes right now? I'm seeing more and more of this in younger and younger people. So I did a little research, and over 30 million people in this country right now have diabetes. It's 30-plus million. Almost 7.5 million people don't even know they have it. Okay, this is pretty significant. 35 million people estimated were pre-diabetic or insulin resistance, and 135,000 kids and adolescents younger than 18 have diabetes, of course, type 1. But we're seeing more and more with the obesity in children, possible type 2.
Can you tell us the difference between type 1 and type 2?
Yeah, well, diabetes, let's start with the fact, let's go to an overview. Diabetes is an illness that's related to blood sugar levels, right? When you stop releasing, or more importantly, responding to normal amounts of insulin after eating carbs, sugar, fats, you can have diabetes. Insulin is the hormone that breaks down and transports to the cell, and it's used for energy. Why do we love sugar? Well, we love it because it's sweet, but we also love it because why? It gives us energy. And this is all secreted by the pancreas. People with diabetes don't respond to insulin properly, and that causes the high blood sugar levels and the diabetic symptoms, which, by the way, I see a ton of. So it's important to know the difference, you're right, between 1 and 2. Type 2 is the one I see in adults for the most part. But type 1 is worth mentioning because it was called for a long time juvenile diabetes. And I actually had a sister who worked in juvenile diabetes for many, many years. And the thing is, it's usually typically found in a person who's developed before 20, 21 years old. The immune system attacks the insulin-producing beta cells in the pancreas. And therefore, the beta cells reduces their ability to create the insulin. This is some of the common causes that cause that were viruses back in the day. People didn't know that. Viruses, kids' viruses, measles, this kind of stuff. And guess what else? Unbelievable. But wheat, cow's milk, soy, so allergies could contribute to the juvenile diabetes. Now, here's the thing. Also, with juvenile diabetes, and actually I believe this crosses over to the adult, it happens that there are problems of inflammation in the gut that can contribute to this. So this is the type 1 diabetes. And listen, the improvements that have been made in this is through stem cells. All right? So this is a good thing. A good thing. Type 2, though, is the most common form, and that's the one I see the most of course, in the clinic. And unlike type 1, it occurs in people over the age of 40, and those who are overweight, obese. This is why it's so important, and it's caused by insulin resistance. That is the big bear, insulin resistant. It means that the hormone levels, the insulin levels being released, but the person doesn't respond to it. Type 2 is a metabolic disease. Now, let me tell you something, John. I see so much of this, which is why I'm a big believer in putting people on anti-inflammatories, and we'll get into this, okay? Insulin resistance can affect anyone. You don't even have to have the diabetes per se. So let's just say you test good in what you think is your blood sugar, maybe a little high. You know, have you ever heard somebody say, "Oh, my doctor told me I had a touch of blood sugar"? Yeah, I don't believe in that. No such thing as a touch of blood sugar. What you probably have is the insulin resistance. So in our facility, we would look at the hemoglobin A, we would look at the lipid panel, we would probably look at all of your liver enzymes and many, many more things. So the diagnostics would be very important, okay? So I'm telling you that this is something that people need to look at. There are many reasons to get this insulin resistance, but I would tell you that people have told me, well, it's genetic. Okay, yeah, it can be inherited, but you don't have to express it, and there are ways to keep this at bay.
So that you treat this with a variety of things, maybe supplements,
big time
hydration.
Supplements through the hydration.
Yeah.
And the reason why we use the big time supplements, yes, you're going to leave with a list of supplements that you can get in the health food store. And believe it or not, that is one of the largest categories in the health food store.
Yes.
This stuff to hold down your sugar, okay? Well, hello, why don't we get to some of the underlying causes? And I will tell you, it's the one factor that also most people who buy these supplements complain about, that they have the GI upsets.
Yes.
So using the hydration therapy, we can deliver many of these supplements, okay, and in a novel way, and really reduce your problems with the GI tract, which I think in most cases is the reason why people end up going back to their endocrinologist and saying, oh, these supplements don't work. We know that's true because you can't take enough of them.
Right. And I know changing your diet is important.
Huge.
Because I changed mine.
I know that. Yeah. I know that. Did we not have to sit with you for a long time?
That's right.
And John, I am going to tell you that I believe your diabetes, which you've had for many, many years, probably the first thing that drove you to me.
Yes.
I would say that was very important, and it really was the crossroads as to you having some of the other problems.
Yes,
people don't realize. And see, the thing is, your lifestyle was conducive to this. You're a guy who's going out, you're meeting fans in the evening. You do early morning radio shows. You eat inconsistently.
Yes.
You can't help it, right? Because you can't eat on the air.
Right.
If you're doing a 12 o'clock show, man, you're on the air, right? You're out doing personal appearances. I remember when you were working Ragged. Right?
Yes.
Okay, I know that you're working also in blocks of 2 to 3 hours at a time, so you never stop to eat. I know this for your Saturday show, right? I mean, I listen. So here's the thing. People whose lifestyles are not conducive to this tend to have this insulin resistance.
We are coming up on the halfway point of the show, and we always say, boy, time flies. We're halfway there already. It's a Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. If you have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210. That's 855-839-1210. I'm your host, John DeMasi. More of the show with Dr. Molly and I. We're returning after these words.
This program is paid for by Innovative Medical Associates.
We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. That's the number. Again, and if you call, you want to make that appointment to sit down with Dr. Molly and go over your situation. The initial consultation is complimentary, and so it doesn't cost you anything. And you'll find out a lot about what Dr. Molly potentially can do for you and how she can help your condition. 856-489-0505. And a lot of good information on the website, InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, and if you have a question or a medical challenge, 855-839-1210 is the number. And you know, Dr. Molly, on Tuesday, when I get ready to come in, I may be depressed or whatever, and then I come into your facility, and guess what? I'm not depressed anymore because there are a lot of people with some serious cases that you've helped.
Yeah,
and
it's true.
Andrew is one of them.
Yeah, Andrew's. You know, John, I love that you want to go into the case studies or the case, at least the qualitative studies on the cases. It reminds you of our old days when we did it over the kitchen table.
Yes,
and so it's true. It's true. Andrew is a 20-year-old guy. Comes from a family business. He travels in from Ohio. These people raise cattle that is used for a lot of big name steak places, this kind of thing. I mean, he has a big family business, and he's 20, and he was suffering from severe depression enough that actually wouldn't let him get up out of bed. He wouldn't get up on time. Father would go in, still couldn't get him up. He was a mess. And it was an interesting case because you would say he has no reason to be depressed, right?
He's 20 years old.
He's 20 years old. He's, his hormones are at his height. He has everything going for him. He's got a family business that's worth millions, right? This guy shouldn't be depressed. But biochemically, he was severely depressed. By that, I mean, when we did the intake, we found out his testosterone was low. which also in a young man and in any man, really, you need your testosterone not just for the sexual activity. You need testosterone to help keep you feeling good, man, feeling good and working out and all of those things. So that was number one. But I have more to tell you on this.
Oh, okay. We're going to pick that up in a moment. We have Thomas in Chestnut Hill. Thomas, good morning. You're on Health Watch. You're with Dr. Molly.
Hi, Thomas.
Hey, good morning, Dr. Molly. I have a question about my brother and myositis, and it's not the usual. It's not dermatomyositis. It's inclusion body myositis.
Ooh, that's very rare.
Yeah, and Peter Frampton, the musician, he has it. And he started a foundation, and it's down in Baltimore at Hopkins. And my brother, he tried to get into, be seen there, but he was seen in the big, Philadelphia centers, and they pretty much write him off. And all there are to be done for myositis patients is steroids, except for inclusion body.
Right.
They don't give it for inclusion body. So his only treatment is PT, and he's gone from being this big strapping guy to, walking with crutches, and it really affects your propulsion muscles and your finger muscles.
Of course. Let me ask you this. I'm not familiar with the studies on this, but when I leave this show sometime today, I'm going to look this up. I'm wondering if this, of course, wouldn't be helped with some neuro type of amino acids that might contribute to some of what's going on for him. Also, I would say the foundation is probably looking at things like stem cells too, I would think, right? Do you know?
Well, it's very secretive down there. You have to be
because
through...
of course. You know why, don't you? You can thank the FDA and all the regulatory bodies, even though they're a foundation. It's a shame. It's a shame. It's really a shame.
Yeah,
anyway.
They don't even have a phone number. But here's another thing. He was in electrical construction, so he was around all these high tension, high energy fields his whole life. So he's 65 now.
Yeah.
And I'm thinking that it might be some autoimmune or something like that. And he's not a believer, but I really think that he might get some help in a situation, in a practice like yours.
I think we might be able to help him a little bit, and I would work like heck to do that because I find this kind of case very interesting. As you know, I've done other muscle-related and balance-related and neuro type of conditions, including what's the famous singer who has that stiff man syndrome. I treated a patient for many years who had something like that and managed to give her some life. Yeah, you remember that, John?
Yes.
Remember that?
Yes.
Yeah. So, I mean, cure? No, absolutely not. But I would tell you, I am interested in his case. Pretty interesting. Why do you guys come down for a free consult? That might be a really fun thing.
That would at least ease your mind as to
come on
what
down.
you can do for that.
Yeah, that's
Thomas,
a great.
Thanks a lot.
Nobody
for the call.
will hook
Appreciate
you in.
it.
I promise. Okay.
Yeah,
that's a great story. Okay.
Another
terrible story, but a
another
great
case of. They
nothing
said,
else.
We can't do anything for you.
Yeah, I don't know. I would
and a
look
famous institute at that.
Yeah, well, welcome to the real world, John. Anyway,
all right, we're back to Andrew and severe depression.
So severe depression. So we ultimately did some blood work. We looked at his serotonin levels, other hormone levels. So when he started with me, he followed a protocol of NAD. Among other things, I can't tell you the exact protocol, but I can tell you NAD was one of the supplements in that. However, he started with us with a serotonin level of about 18 or 19. It was age, believe it or not. When he left this Friday, he was back in low normal range for the serotonin. His testosterone his free testosterone went from, I think, 100 to 300, which was great. And his total testosterone went from, I think, 150 to actually 650. So we managed to tune him up and send him on his way. However, we also put him, this is where I come in and say the docs and I had a full conversation, reviewed the chart. We put him on an antidepressant that we did a genetic test to make sure that his genes could utilize the antidepressant in an effective way. So again, I'm not against medication. We were able to use an oldie but a goodie. People know it, Lexapro. It's been around for years. It has an anti-anxiety component, which we believe he has a piece of. and we put him on a dose of this. Interestingly enough, the genetics came back that he may need a trifling higher dose than what would be the standard dose. Of course, the physicians have the ability to use medication in different dosing if appropriate. But what I love about what we did, John, is we actually have the genetic data to show that that drug should work for him once we've tuned him up. And in addition, utilizing what? Utilizing the natural substance to augment that and keep this boy in check. He just left on Friday. I have a follow-up call with him this Friday. And then what will happen is we talk as the team ongoing on his case. We'll be talking to him once a month, going through the medication and also finding out how he's doing with the diet, etc. And hopefully we can keep him good to get till we get him back in 6 months.
So there's an ongoing process.
Dialogue, of course. We're going to do telemed, as they like to call it. Not something I love to do, but they're from Ohio, so in this case, it's prudent to do it.
And do you find that he's on the path?
I think he's on the path. I think a lot of this has, and by the way, folks, I don't think you shouldn't go to a therapist. I'm a big believer in the therapeutic process. When you have a good therapist or a good psychiatrist who does therapy as well as just manage drugs, you can get on the road to recovery and recovery quickly. But I do believe that it can be enhanced by the NAD. And there's a lot of data out there showing that people recover from this depression really quickly, utilizing this and also an off-label use in a microscopic dose. I use it by spray. It's incredible. It's usually used in a different manner. It's usually used by anesthesiologists. And I will tell you, because I have one on board, my medical director is an anesthesiologist. We use it, and I'm telling you, it's made all the difference in the world along with the NAD.
Fascinating stuff, and we have more to talk about here. We're coming up on our final break of the morning. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is the number here in the studio. We still have time for a couple of questions here if you have those for Dr. Molly. And if you have a medical challenge you want to run by her, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I return with more of today's edition of Health Watch after these words. We are back here on Health Watch, and you've heard us talk a few times about the initial consultation. And if you want to set that up, operators are standing by right now at Innovative Medical Associates, 856-489-0505. And they will be there well after we leave you at 9 o'clock. In fact, it's a nice day, but they're working, okay? 856-489-0505. That's the number. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. It is Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. We are here in the studio. 855-839-1210 is the number. Let's talk to Charlie in Philadelphia. Charlie, good morning. You're on with Dr. Molly on Health Watch.
Hey, Charlie.
I'm in my very late 60s, and when I was in the 70s or 80s, there was a popular diet. At the time, I didn't eat meat. I didn't do yoga. I sort of into it, but it was called the macrobiotic diet. It was mainly brown rice and balancing your yin and your yang and your
You know who was a big deal in that? Denny Waxman.
It was a big deal.
Yeah.
I know a lot of people that got on it. It did wonders for their arthritis, and I've been sort of like doing that with apple cider vinegar and lemon juice. And a lot of that stuff brings down your inflammation. It does work. My feet are much better than they were 5 years ago. You know what I mean?
I agree.
For arthritis and stuff.
I have no problem with that, Charlie. I think that's great. As it was, I was a big proponent of Denny Waxman back in the day, God rest his soul. He was one of the few guys that did this along with Christine Perillo. So believe me, I get it. But you see, for many people, and you're a smart guy, you say you're in your mid-60s now. You were much younger when you started this, and thank God you did. So, but I have people who come in their mid-60s who haven't started anything. And the quickest way to jumpstart them is through the medical hydration. So I agree with you. You're a smart guy. And believe me, we talk about some things like that. And then there's also people who can't do it.
That's just what I was wondering, macrobiotics, I think it was called.
No. We still hear it, and I still have practitioners who we can refer people to. So God bless you, man. Keep it up. Keep it up.
Thanks for the call, Charlie.
Thank you. Thank you.
Let's talk to Mike in Burlington, New Jersey.
Hey, Mike.
Good
How are
morning.
you? Hey, Mike.
Good. How are you?
Good.
Nice to talk to you.
Nice to talk to you guys.
Thank
Go
you.
ahead.
I have a question about AFib. I've been taking metoprolol and aspirin, and for 4 years, and I was told no soda, no coffee, limit sugar, and I am tired all day long.
I know.
I don't know if there's any kind of other thing out there that.
Well, the first thing I would probably do, first of all, what is your AFib? What are they relating it to? Is it a valve? Tell me about. Go ahead. Tell me about it.
The right side, yeah, it's on the right side.
Yeah.
And I was my heartbeat was going up to like 122, 130.
Okay. Yeah.
And I went to the hospital. I'm like, there's something wrong here.
Sure, you're smart. Listen, one of the things we put our AFib patients on is something called taurine. I've spoken about it before. It's an amino acid. I want you to use it carefully. I don't suggest you just go into the health food store and take it. I think we talk about it, and come on in and come to the free consult. And I tell you, we have an IV that actually does wonders for people. In fact, John, several of the people you see on Tuesdays have AFib, and you can hear them talking about it. The other thing is, what else are you taking? Are you taking any supplements at all, my friend?
Just I take B complex.
Okay.
I take a vitamin D, and I take
Good.
Because I was diagnosed with low on both of those with my cardiologist. And
Sure. Makes sense.
So,
Makes sense that would
I'm
contribute.
60 years old. I'm trying to get
you need a couple.
Hey,
listen. You're going to get a couple more years.
You're a baby.
You're a
6 years.
baby. I don't even want to tell you how old me and John are. Okay.
Yeah,
but I'll
we're
tell
well
you
past
what.
you.
ought to come in and see some of the people in our place. It's unreal. We can help you with that.
Yeah.
God bless you, my friend.
Take advantage of the initial consultation.
All right. You're a nice guy.
Mike,
God bless
thank
you,
you.
Mike.
Thanks for the call.
Yeah, they make it a mystery, John. Go ahead.
Okay, we want to talk about another
Joan.
patient, Joan.
Yeah,
and this is a very, very fascinating story.
This is a
and
great
a good
thing.
outcome. Yes.
Well, it's a good outcome. Now, listen, you've heard me say we do supportive care for cancer. Okay, Joan is a person who's very intelligent, and actually her husband's extremely intelligent too. Really smart people. They come down all the way down from North Jersey, and I mean close to the border of New York. She was treated at one of the New York's finest institutions. Okay, she's been going to chemotherapy while coming to me. So, of course, we're very particular about the type of IV treatments and medical hydration that we give her through the chemotherapy. But I'm going to tell you, she maintained her blood count. Now, she's been doing this for at least 5 years. She's been going to chemotherapy for 5 years, okay? Jeez. She's been doing exceedingly well. She had breast cancer. She started with me at a stage 4, okay? She had done surgery. She did everything that the traditionalists told her to do. Well, she had all of her CT scans for the last several years have shown no growth on the tumors, blah, blah, blah. And this last CT scan that she had about 2 weeks ago, it showed no growth on the traditional, where the original tumors were, but she had a few spots at the brain level, and that's not unusual. Nothing in the bone, though. God bless her. Okay? Now, she's religious about coming in at least once every other week should she need it. But she did go away on vacation, which we encouraged her to do. So, anyway, the treatment for this is to actually get radiation. But she, being as smart as she is, she decided that the radiation options that the large institution gave her might not be enough. And we knew of something else being done from another large institution, but a little differently, in North Jersey. She went to see the interventional radiologist, who actually is a real gentleman. She saw him. He took care of all of the initial treatment the day she went up for the consult. He did not fool around. He said, we're going to get on this this right away. And he said, one of the reasons why I'm so fascinated about your case is how good all your blood work is, how good our medical exam is on you. You don't look emaciated. You don't have all of the usual stuff that goes on with patients by the time I see them.
And didn't he say that most people don't come in this way?
That's right. Yeah. And she said,
so he was impressed.
Right. He said, why are you like this? She said, you need to talk to Dr. Molly Fantasia. Well, I'm honored, I have to tell you, and I was quite floored. Anyway, that he gave her his direct phone number. She called me and asked me to call him because now I have to change even the recipe I've been giving her through the chemo. And, of course, I called him, had a wonderful chat with this doc. He's a smart guy. I'm going to refer patients to him who have to do this kind of treatment. And this goes to show you that everything I say about supportive care is important.
Yes.
And he was so impressed. He said, you got to get your cards up here. I have patients who need you.
Okay, and you're going to mail cards up there. And that's a good note to end the show on. Okay. With that, we put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates, 856-489-0505. That's 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda and our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel. And then, of course, there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, Health Watch, 8 till 9, Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.